I
Just
don't.
having pelvic pain.
I hurt myself really bad, and I don't
Write your
know.
name, date of birth, PCP.
I don't know what I did, but it hurt.
Fell or what happened?
I did end up falling down, but it was as soon as I jumped up and was trying to chase this other dog and get this other dog off of her. After that, I went to walk, and it's like my whole pelvis.
Just right. It's okay.
Just gave out on me, and I went down.
It's a disaster.
Already trying to give me issues saying that Maya can't come with me.
I'll have nothing to do with that. I'm perfectly cool.
There's no reason she
about
can't.
OB upstairs.
Oh, I've already talked to labor and delivery before. She's allowed. My doctor has said she's allowed.
I'm perfectly happy with your dog hunt.
Yeah, no, you're fine.
I understand, but
What's different?
all right, can you dial the OB number? So
Oh yeah, I'm recording. Already.
What's different?
Nothing's
They're
different.
just fall pelvic pain.
Both.
Okay. You're 36 weeks.
I'm supposed to be induced in 12 days because baby's not getting enough oxygen and growth restriction.
Emergency department. They said no.
She said no.
All right, I got Dominique Weems here. Okay, so yeah, that's. I don't. Okay. I don't have a problem. So y'all are aware of the patient. Okay. All right, so I'm gonna come up there. All right, so the dog can't come. I'm
She's
sorry.
a service dog. That's against federal law, and I'm recording this right now.
That's fine. Listen,
I've already been told labor
here's
deli-
my job, and that's to get you upstairs safely. And
I
know
have
you want your
medical
dog.
conditions. I
know
cannot
you
be
want
separated
your
from her.
dog, But we need to get you upstairs. The head CNO is telling me no. I can't do it. So can I
They
please
let
just
her
take
upstairs before, so I don't
Well,
understand
labor
the
and
difference.
delivery just called me personally and said no.
And I've spoken to labor and delivery
dog.
before. It's
I'm
against
totally cool
federal.
with dogs.
I have medical conditions. She is legally allowed to be with me. You legally cannot deny me. And by y'all doing this, I am videoing right now. This entire hospital can be sued. I have talked to labor and delivery. She is legally allowed. I've been into labor and delivery multiple times in the past. Dr. Schulman is aware that I have her, is aware that she's going to be there with me when I'm in labor.
You have to understand, I'm an ER person. I'm just trying to take you upstairs. That's my job. Is I'm not up there. I'm down here. I'm trying to help
Then just
you.
take me
This
upstairs
is
and
what
I'll
they told
argue
me
with
to do.
them.
I cannot bring the dog with me, and that's that. I'm not trying to stop you again. I love dogs. I'm totally cool with it. I'm just doing what
She's
I'm told.
a
You have to
service
understand
animal.
that.
It's against federal law.
So,
The only place that she is not legally allowed in a
Your
hospital.
husband?
I am.
Somebody want to talk to you on the phone.
Okay.
so we need to help. And we need to make sure your baby's okay. And
And my medical issues, I need her. You can't tell me before certain things happen. She can.
you're in a hospital. We're trying to take care of you. I'm not.
And I'm sorry. I know I'm in a hospital, but sometimes a dog's
Nobody's
nose is
trying
better
to
than.
fight with you, okay?
And I hear you. I'm in a lot of pain. I've spoken to labor and delivery. Labor and delivery told me I was all good having a service animal because legally she cannot be denied access. My doctor, my OB, is aware that she's going to be there with me when I'm in labor because of my medical conditions. And this is against federal law right now.
One 746. Yes, ma'am. Thank you.
You're welcome. You're fine. That's all I was going to try to help you get through. Thank you. At least 3 minutes. I got on the He's going to 6. He in room 6. I tried to call that man too.
Come. The only places in the hospital she is not legally allowed is a burn unit or an operating room. Dr. Schulman is aware that she's going to be there with me, babe. Labor and delivery has told me before it would not be an issue. Maya, sit. Me?
Yeah, Dr. Coleman.
Yeah, Dr. Schulman is aware she's going to be there.
That she's going to be there.
I've been told by labor and delivery before that it would not be an issue. And it's illegal. It is violating federal law, and I swear to God, I will sue this hospital if I have to. That is how I'm feeling right now. I'm in a lot of pain, and I just want my treatment. This is against a federal law.
Well, we're trying to make sure she's okay right now.
I'm sorry. Maya, come. Out of the way. Good girl. Sit. Legally, they cannot separate me from her.
Okay, is this a service dog?
Yes.
Do you have your papers?
There is no paperwork. She is a service dog for medical alert and response and PTSD response. These are the ADA federal laws. If you guys want to look over these,
I mean, I understand that, but you're supposed to have paper.
no, there's paperwork.
Like 10 minutes ago and told me there was a patient coming with the service animal and she's supposed to be coming upstairs. They told me to not let the dog upstairs.
I have been reassured by labor and delivery that she would be with me. Dr. Schulman is where she's going to be with me when I am in labor.
Okay,
I've-
stop talking for me. You said they told you what?
They told me to not let the dog upstairs.
Okay.
That's against federal law, and I swear I will sue this hospital. Everything is being videoed right now. This
We don't care nothing about that.
she is.
If they said that the dog can't go, then the dog can't go.
That's against federal
I
law.
don't have nothing to do with that. We have to just do what we were told to do.
Okay, and I'm sorry. What's your name?
None of your business.
None of my business, ma'am. Excuse me. It is my business because
Ma'am.
no,
You can't videotape
listen.
it.
I can because this is against federal.
Record all you want. What we're saying right now is
She
No,
cannot be
listen,
separated
listen,
from me.
Listen,
Sir, they're saying it's okay, so just calm down.
I never got loud.
You're in my face. You were bent over in my face.
So we
talking
trying
to you.
look around.
It's
You
the
can't talk
COVID
loud.
thing.
You
It's
cannot.
Y'all are all. I have PTSD, and you are all surrounding me right now. What do you expect? I am in pain.
No,
And y'all are all around me.
Go get her a mask. See, do you know COVID is out?
Yes, I'm aware.
Okay.
And nobody
Well,
offered me a mask when I
should've
came
came
in.
with one. You
I
didn't
didn't
know?
have one because I just hurt myself, and my husband had to pick me up to rush me up here. I'm already having to
Okay,
be induced because of issues with my baby.
Okay, we're not trying to upset you, but we have to. The safety of the
Nobody wants to
hospital.
just. I hear that, and I don't
Okay, put
mind.
that on while you talking. Put that on.
I don't mind a mask because somebody would have just handed it to me when I got here.
Who is this?
That's my husband.
What they say?
It's just the COVID thing. I don't know what changed when COVID. That's the only thing.
What did they say?
She's coming out.
Okay.
But she's got severe anxiety and PTSD, so I would appreciate it. Just,
There was a labor and delivery nurse right there.
Okay. Hey.
Thank you.
Dr. Shulman knows that she's gonna be with me when I'm in labor. I've been already told by.
Okay, listen, sweetheart, we can't do this out here.
Okay.
What I do want you to understand, I am the director for the division. I've talked with Dr. Schulman, and I've talked with the nurses.
Okay.
Your precious dog at 7 months won't meet the criteria for service dog for anxiety. There's a bunch of
Yes,
questions.
she does. What do you know about federal law?
Okay.
I have a
know I'm
YouTube channel. I have a YouTube channel, and
Do
this
you
is what I
want to
do.
be seen and screened for the fall that you happen
What
to have
criteria
based
do
on
you
this?
need for her?
We're gonna get Lisa on the phone and let her talk to you. How about that?
Huh?
Will that work? We can get Lisa on the phone and let her talk to you about it.
I'm just wondering, what questions do you need to ask me? Go ahead.
She's gonna ask them, okay? I'm out
Whatever.
of it. I'm gonna let her talk to you. Okay?
Whether she is in training or fully trained, she is legally allowed per Alabama state law and per federal law. It does not matter.
She failed or something? She failed or
She
something?
is already.
The word that I had was that you fell down because your dogs got into it with another dog or something.
No, I had another dog attack her,
Okay, that's what happened.
and I went to run. I jumped up and went to run to get the other dog off of her.
Right.
After that, I was in, I don't know what I did when I jumped up, but I went to try to get my 4-year-old, and we went to try to walk away to leave because we were at the dog park and they were running
Fall
around.
down. That's what I
Yes,
I'm good.
it was after the fact. But I had this other dog jumping at her in her face trying to bite her, and she's just trying to run away from it.
They're probably just gonna check her out right there. And if so, you and the dog.
She can't be
just go
separated.
outside.
This
how
is
that's-
against federal law.
that's
My
how that's
hospital can be
probably gonna go.
sued.
Unless they're in a surgical environment, the dog does not have to leave her.
Unless it's a burn unit or I'm in an operating room. Those are the only two places she is not legally allowed.
Federally.
That is
If
federal
they-
law
if
and
they
Alabama
say-
state law.
If they say that it don't meet the criteria.
Then I guess we're going to have a great lawsuit on our hands. That is how I feel right now.
There's several other hospitals here that should you go to.
She is for PTSD and medical. She is behaving like. Oh.
We need to call Brian here, security.
Oh, this is gonna be a wonderful lawsuit. Truly wonderful
I mean,
lawsuit.
if they disagree, then yes.
Oh,
absolutely.
this video is gonna blow up on my
Because federally,
YouTube.
That's illegal.
I've already got 26 million views on my YouTube channel. Let's add another mil.
And it's not going to look good in the hospital. So hopefully they can understand. I'm really not
I've already
happy
been
about this.
reassured by labor and delivery that there
I
would be
rushed
no
out here
issues.
to
I was
make sure you're
reassured by
okay,
Dr.
and if
Schulman.
They feel like that's not legal.
That's fine. Maya, come. Come. Good girl. Sit. Good
Hold on,
girl.
Brian. Hey, I'm sorry. I was trying to call Brian. I called
Wait.
you. Let me call Brian. Talk to Brian. Okay.
Oh, have you?
Okay, Brian.
Okay, perfect.
Hello? Okay, we have this pregnant woman in here with a service dog. She says she is for medical reasons.
And PTSD response.
Yeah.
Medical and PTSD response.
Medical and PTSD response.
Yeah.
She don't have any papers
There are no papers
on the
legally.
dog.
ADA law.
That's federal law. There are legally no
Okay.
papers.
Well, upstairs, they said that
I'm a service dog advocate. That's what I do. Is I advocate for service dogs and invisible disabilities. That is my job.
I hate that they're giving you all this. We're trying to make sure you're okay.
Okay,
This is
ma'am.
coming.
The director from labor and delivery is down here also and told her
Are you on
that,
your way down then? Is that what you're?
because the
we're trying
dog
to
is
figure out
7
how to
months,
make
so
sure
she's
we
7
can
months or
check
something.
her
The dog is
out
not really
for,
allowed to go to labor
the
and
fall
delivery.
that she had with
And
them.
she wants to sue
She will
and this
stay out
all
of the way.
kind of foolishness.
I'll be in my bed. She'll be
The
on the
thing
floor,
was, she
out of the
failed.
way.
can't
The
let
thing
this
was,
go
she's not in labor.
though, with
She,
this. Okay, all right.
another dog was
Are
trying
you
to
okay?
attack her dog or something.
Good,
and she
good,
ended
good,
up
good.
falling.
Okay,
So
okay.
she really just needs to be
All right,
seen
excellent.
just for
Well, go
falling
rest.
to the emergency
Okay.
room.
Um,
Uh-huh. And
no,
so,
no, that's one of the other.
patients.
How many hospitals have I been in
Okay.
with her?
Yep. Okay,
Can't
listen.
tell you how many.
Listen. This is the director over security. As far as her being seen for her fall, the dog can go back there to be seen. But if she was to go, just in the ER, if she was to go upstairs to labor and delivery, a lot of service dogs, it would not pass because they cannot go to sterile places.
Unless it's an operating room or a burn unit, she can't be in there. My doctor, Dr. Schulman, is fully aware that she is going to be there with me when I go into labor.
Into labor.
When I am in labor, while I am at the hospital, she's going to be with me. He's going to be taking me, and Dr. Schulman talked about it yesterday. He will walk her out to use the bathroom. He will bring her back in because obviously he can't leave hospital grounds anyway. So he will be there to help assist me take care of her while she's helping take care of me. Dr. Schulman was petting her yesterday, trying to get to know her a little bit while I was going
So
under.
what did they say?
Laura's coming down. What we'll do is we'll get one of the L&D
I've been in the
house
to actually
supervisor.
do the screening
Okay.
and actually do it down here because based on what's happening with COVID and infection prevention, you know,
I've
if
been
it's
into
not a situation where we're going to go do a quick surgery and that kind of thing, then we'll screen her here.
I've been into
but Lori will be
multiple
down in
labor
just
and
a little bit.
deliveries.
Okay, what about a house supervisor too?
That's not a
This
bad
is
idea.
Brian. This is Brian.
That's not a bad idea. Go ahead and
we
let
can
me
call the house
them.
supervisor and let them make
And
the decision.
your name's Stephanie, and
It
you're
is
the director
Armstead.
of
Because
women's
she's saying
and
that she
children.
talked to her
Yeah, I've talked to labor and delivery here, and they said it wouldn't be an issue. When I've called before, I've been into labor. I just got transferred over to Grandview. I've been.
From where?
in the room.
I was
with
at
her while
UAB.
she's in
She has
labor.
been up to labor and delivery with me at UAB multiple times. She is legally allowed. That's federal law and Alabama
Same
state
with
law.
Brookwood.
Same with Brookwood too, because I was at Brookwood
Okay.
before I
And
got
this was
transferred to
during all the
UAB.
COVID.
It does not matter what is going on. She is still legally allowed with me because there's things that she can do that you guys cannot do. Even though y'all might be able to treat the matter afterwards, she can help assist me with the matter during. All she does is when we are in a room, my husband sits in the chair and she's in the chair next to him, sitting on the floor.
Okay, well, there's something she doesn't want us to hear.
I'm hurting.
I know, and this is delaying it because whoever doesn't fully understand the idea at all.
No, it's not
Not
that
you
at all. I've
specifically.
actually worked with patients that have had service dogs, and I remember most of their names, like Phaedra and...
So what's the issue right now? Like the two legal questions. Is she a service dog required for disability? Yes. Is she task trained? What task is she trained to perform? She is task trained for PTSD response. She is in training for medical alert and medical response. Oh my God, this is ridiculous.
Or just keep your phone on because if they would have told us that, then they can deal with it. They can deal with it afterwards. This is ridiculous.
So, the living room, it's a little bit grander.
Were you able to figure anything out?
Finish the floors, paint, this room.
Were you able to figure anything
Like-
out?
I have, these are ADA federal law. I have the card.
That's why we're not disputing. Okay, look, we're not disputing. We see that, but we're just trying to make sure dogs are allowed here. Those
Service animals.
Service animals are allowed here, but not in certain areas. Not
The
in sterile.
only-
Not,
well, legally-
No, listen. Not in sterile.
And sterile environments, correct.
And
And that would be in.
listen, it says too, maybe not like in the labor room. It's pending. It's on our website.
No,
And so,
Dr. Schulman has already said
Okay.
that she could be there.
listen.
I mean, I keep getting interrupted when
Okay.
I keep trying to explain that Dr.
Because
Schulman has said
he's
it.
going to send it to me. My phone number is. You got my email? Or you go?
Dr. Schulman's already said it was fine. I've had my other doctors.
215-2512. Uh-huh.
You did hear us say that. He said that the dog would be there during labor.
Like she has her own bag packed for the days that we're supposed to be here.
Try to make sure you're okay, but
Yeah,
yes.
Yeah, the only sterile environments would be a burn unit and an operating room. Those are the only places in a hospital per federal law that she is not allowed.
Okay.
And that
Now,
is
let me
federal
tell
law.
you this. Videotaping. you
Right
can't do
now
that
it's
here.
for my rights.
No, but I'm saying
It's-
you cannot do that in our hospital.
That's
It's on,
right
it's
now.
on, it's on the doors.
And I
everything.
wouldn't be right now if we weren't having this issue, so I hope that's understandable. We're having an issue right now. This is my protection, ADA. This is my protection if I have to sue.
She called the house supervisor. Hold on. She's coming down.
I am a YouTuber. It is my job. I
She's
actively,
in the emergency room.
I
It's a
actively,
liability. mean,
I advocate
And the,
for service dogs and
When
disabilities.
we're given issues, that's our liability. And we should be
She told she got a YouTube channel and all that kind of thing now.
I am a service dog advocate. I advocate for the laws, for disabilities, for service animals,
Not yet.
so that people don't have to go through this.
Okay. Okay. Yeah, Brian for the call right back. I'm trying to find it. My boss just sent me the link to read. Let me say, service animal dog. General type.
But now I'm trying to figure out if it goes against what her doctor told her about the dog being in
See, the
there.
thing is, a doctor don't make the rules.
I
It
understand
goes
that.
from administration, and doctors
What about
can't tell
federal
you
law?
that.
Why would he tell her that then?
Because see, it's still
Because
sterile.
he's following federal law. It's
No,
not.
it's still sterile.
There have been service animals allowed in labors before. They are posted all over the internet if you want to look it up about service animals being there in labor rooms.
Well,
It is a sterile environment for me, but unless I am having an open C-section,
He's gonna call the hospital. Yeah.
unless I'm having a C-section, she would not be allowed in there, and she would not be allowed into a burn unit. She legally can still be there with me when I'm in labor, though. Maya, stand up. Good girl. Back up. Good girl. Back up.
Oh, let me just slam him.
Good. Come. Right here. Sit. Good girl.
Well, time is precious, so let's hope something really isn't wrong.
I mean, I'm already having to be induced because I might have a stillbirth because my baby's not getting enough oxygen, so.
Now they're gonna take you back to the back and let you get checked out. That's not the problem.
When it's already been 30 minutes.
Well, I don't know how long you've been here. I'm sorry.
I mean,
just
the
called
moment
us.
I came in, it was immediately an issue, and legally, that's not. This is all against federal law. It goes against Alabama state laws. This is completely 100% legal.
Inappropriate. However, it may be appropriate to exclude a service animal before from operating room or burn units for the animal present in the
Yes.
A service animal must be under the control of the handler.
And those are the federal laws that I've already been telling you guys.
But it's not.
I have, this is ADA federal law as well. These are the little mini cards from the ADA, the same page that you're reading from right now. That's what I just recited to you is the burn unit, the operating room. Those are the only places in the hospital that she would not legally be allowed, where y'all could legally turn her down. As far as the rest of the hospital goes,
Let me just, I don't want you to think I'm making the rules.
No, I hear
they
you.
just, you know what I'm saying? They just called us because,
and I get that y'all have other people telling y'all certain things. So
yeah, so
and
we're
I
just
know-
trying to go from what the head say.
And I understand that, and I'm sorry if I'm coming off. I'm in a lot of pain.
I understand,
You know,
and I want you to
it's.
go get checked. And I know he should,
I mean,
he or
you
she
can
would-
tell.
I mean, it's a good dog.
You can tell by
Yeah.
her behavior that she's not going to be an issue. She's behaving, and I've never had issues
She's
like this.
shiny. We can see that. We can see that. So I don't want you to get upset. They're going to see you. But I don't know. they gonna see you, so don't.
But
worry
now
about
I'm
that part.
wondering what's going to happen when I go into labor. Am I going to be in labor coming up for my induction in 12 days having the same
No,
issue?
if the house supervisor don't say,
We're gonna do the screening here, and so, one of the nurses from L&D, once they get her checked into the room, we'll do the strip and, look at baby and all of that.
So what am I going to do in 12 days when I go in to be induced in 12 days?
I don't have the answers for that right now today, but right now we're gonna get you checked in and see about it, okay?
Okay, well, I kind of need to figure out if I
hold on
need
a
to change
minute. Not
hospitals
yet.
before my induction in 12 days.
Let's hope not.
There are no hospitals allowing service animals into
I guess the
sterile
third floor
area.
is coming down
Labor and
here
delivery isn't
to do a screening.
technically a
It is.
I just came from UAB. She has been in labor and delivery with me
Okay,
at
so they doing
Brookwood
that,
before I
but
got
her
transferred to
thing is,
UAB, and then
her
UAB transferred
baby
me
should be
out,
born here
saying I was
also,
no
so
longer
they're
high
trying to see
risk, and then we found out that I
what's gonna
am
be
high
the
risk.
rules.
I'm supposed to be induced in 12 days. Legally, per federal law, per Alabama state law, this is illegal for you guys to do, and this is going to be a huge lawsuit on y'all's hands if that's the case.
We're huge fans of service animals. I've had these made for our service animals as a visual indicator, so everybody will know.
What about Dr. Schulman? He did say
Dr. Schulman knows that she's going to be in the labor room with me.
It's a different. He's doing his part,
Okay, let
and he
me-
called me to
hold on,
handle
hold
his part. Okay, I'm Lori. I'm the infection control
No.
professional here. Hold on just. I'm the infection control.
so. He called her to handle
The infection
this.
control person. The infection control person is tell him to I know.
This is, tell me your name again. Lori. She said, hey, Lori, hold on, he want to talk to you for a minute.
We're the ones that changed it.
Don't get upset, don't get upset. They come down here to screen you, so that's the first thing.
I know, but now I'm trying to figure out I'm supposed to be induced in 11 days. My baby's got is growth restricted and not getting enough oxygen, so they're having to induce me early just to try to make sure that he's okay. And I've never, every other hospital that I've been at, I was at Brookwood before they transferred me to UAB, thinking I was high risk, and then UAB said, oh, you're fine, nothing's wrong with you and the baby. They do an ultrasound yesterday and then find out, oh, actually something is still wrong. And that's the only reason I'm even here. I'd rather be back at UAB right now, because UAB never, I was in labor and delivery at UAB, like 2 or 3 weeks ago, because I passed out and hit my head, because that's part of my medical issues. I pass out a lot, just one of the reasons I've got her. Nobody gives me any issues. This is the first issue I've ever had at a hospital, and I've been in labor and delivery multiple times with her.
Hey, yeah, so, okay, so they're gonna check you out down here, okay?
Okay.
But we are not set up to be able to allow a service animal into the labor and delivery area.
Then why did UAB do it? Why did Brookwood do it?
I can't answer for those facilities, and I'm very good friends with those
Maya, leave
people
it.
there, and they have similar
Come here.
policies. Also, the COVID pandemic has exploded, and so we're all wearing a mask, and there are even more special precautions in place, and it's for your protection.
But federal law, that doesn't matter. Would you deny me access with my oxygen tank or my wheelchair if I came in with my oxygen or a wheelchair?
I hear you. I do. I hear you.
She is medical equipment in the eyes of federal law. So if you would not deny me access, if I came in with an oxygen tank or if I came in with a wheelchair.
She's with you now. She is with you now.
But what about when I go into labor?
She cannot go in a sterile procedure per the law. You know.
That's an operating room or a burn unit.
It doesn't say operating room. The
There have been, it does specifically under federal law, it does specifically state the two places as an operating room and a burn unit.
They use those as examples. And so,
Okay.
hang on, I wrote it. Procedural suites.
There have been many service animals.
This is verbatim. Pre-op
Labor
area
and delivery
recovery.
rooms. If I was to have a
What it is,
C-section,
we have special.
I want to see the law where it says
Yeah,
she
those
can't.
were examples. We have.
No,
there's-
they're not
there's-
just examples.
There's even special air exchanges that occur so that you don't get a post-op infection. Okay, there's special air exchange, like there's positive pressure, negative pressure, and when you're delivering, it's positive pressure. And there's so many air exchanges that have to occur, and that's kind of considered that same special area. But we want you to be checked out and make sure you're okay. All right, now, so the animal is fine down here with you, but it would not be able to go to the L&D area. Okay.
And that makes no sense.
Right.
Because she has been to labor and delivery at other hospitals with me.
Yeah.
Dr. Shulman was aware she was going to be with me. Other service animals, it has been on the news about other service animals
Hey,
being.
I'm one of the biggest fans of service animals. I have a 120-pound
We're not
Shih
trying
Tzu
to argue.
German. I understand.
My job is, I'm a YouTuber. My whole job, though, is because I literally advocate for service animals and disabilities.
That's awesome.
I know the laws like the back of my hand. This is
Another
not.
thing, so the handler, these are their rights and responsibilities. So the handler for the dog will be, who will be the handler?
She is mine. I am the handler until if I go into labor and I'm in the bed, he will take control and he will walk her.
When a patient is in the hospital, the patient cannot be the handler.
Then he's the handler. He can be the handler.
So the law says that too.
But as a whole, she's for me, yes, but he can take charge of her.
Right, and so none of the staff can touch
And that's
or pet
fine.
or anything. If the animal growls, barks, is disruptive,
Y'all have every right to remove.
then you know that.
Yes.
And then any kind of, if she needs to go outside while she's in the ER.
That's his job.
Yeah. So I just want to be sure you got
That's something we've already been prepared for.
You're not the only one that this has affected too, and we have we're going like extra provisions and going an extra mile to try to be advocates for service animals. But in that procedural area, it just cannot go in there. It's no different from walking into an operating room. You have sterile
Then that would be
setups.
the case at every hospital,
Well,
not
I
just here.
can only speak for my hospital. Okay,
But there
I
will
hear
be no operating done. There will be no.
I'm just
procedure
being
done.
induced. There have been that's not.
Well, she's induced, yes.
If she has to step out of the room for a moment,
Well,
I'm
she's
sure
not
my
gonna
husband
be
can
able
step
to-
her out of the room. But
She
other
wouldn't
than
be able to be in that room because that is a sterile procedure when you deliver and the baby and the cutting the cord and all those things. But I want you to be okay tonight. Okay. Let's make sure you didn't. How did you? What happened with you? Did you fall?
I went to the dog park with her, and my 4-year-old wanted to go, so we went. Somebody brought in an aggressive dog, and as soon as they came in, it started attacking her, trying to literally rip her face off. And I jumped up off of the bench I was sitting on. I jumped up as quick as I could to run. I went to run at them to try to get this other dog off of her. Luckily, she's fine. No punctures, no bleeding. Maya, sit. And then I went to leave. And as I went to leave, the pelvic pressure and the pain started so bad, I just dropped.
Yeah.
I dropped, and he's had to pick me up in and out of the car because I don't know what I did. It's my hips, it's my pelvis.
Sure okay. It's okay. You're gonna be all right. All right. This is what Maya is her name.
Yes.
This is for Maya. You don't have to put it on her. Okay, but this is our visual indicator to let the people down here know.
If you want to put it on her,
that
you
she
can.
is okay to be down here. Okay.
She wants her to go. Can she go back there with her?
Yeah, she can go back to the treatment room and Yeah, that's fine.
Okay.
Yeah, and then we've gone over the rights and responsibilities, and you're familiar with that as far as the handling of the animal. So we're good. I'll chart that in your record, and we'll be good.
So what would I need to do to get in touch with labor and delivery before I get induced in 12 days?
Yeah. So I've spoken with them, and they.
So y'all just aren't going to allow it as a hospital?
Right.
Okay. Well, I guess at least I've got that on video, and I guess I'll proceed with what legal actions I need. So thank y'all.
We just want to make sure you're okay.
So are
right
you
now.
filming me right now?
I've been filming the entire situation.
Okay. So that's
Because it's ADA federal law, and when I was immediately told that she's not allowed, I've got to protect myself with the law.
She is allowed everywhere that visitors and patients could normally go without infection prevention precautions in place, but not in a labor and delivery procedural operating room
But that's not
area.
how it's been at every other hospital I've been to. So,
And Dr. Shulman said.
and Dr.
she
Shulman was
could be
fully
there
aware that she
while
was going to be there.
in labor.
He called me because he said that you had shared that with him. He called me to help you and to assess everything.
Okay.
For everybody's protection.
Did he mention that he was out?
Yes. He that's why he called me. So because that's our policy is that infection control department is aware when we have a service animal and they make sure that everything's in order and.
So he wasn't an authority to say that the dog could be in there.
You would think the law would be enough authority, but I just right now, can we just
Yes.
one battle at a time?
And I'll let them know that too. Okay. Good luck to you.
Thank you.
Okay.
Oh,
Like, yeah, right here, that's COVID, so back there, so. You in the,
come here.
you okay?
Good girl. Leave it. Right here. Sit.
Okay.
Oh.
Okay. You good?
Yep.
Okay.
As good as I can be. I don't know that I don't want to be here anymore. Can we leave? Can we just leave? Can we go somewhere else? Please. I don't even care. I don't want to be here anymore. After how I was just treated, I don't even want to be here anymore. This is not okay.
I wasn't trying to be mean, but when they started getting all around you and close like that, I had to speak up and say something.
Thank you.
It's just ridiculous.
And they're bending over, leaning over, like in my face. I've never been treated so bad before. I just want to leave. Can we just go to a different hospital? I can walk straight into UAB and go straight up to labor and delivery and they won't say anything.
Yeah, I know.
No, I want to leave now. Because if something is wrong, I'm not doing this here. I'm not going through this here.
We're already here.
I don't care if something is wrong and they want to tell me that they have to admit me. I am not doing this here. I'm not. I don't want. Give me my bag. You have a drink in there, right? I can't pretend like I'm having a fucking anxiety attack right now. No, this is not okay. I'm gonna have a distraction the whole freaking time. The one who's gonna argue with me about the fact that I was serving. Are you freaking kidding me?
How have we been here? We've been. Someone possibly going into labor
This is a bad contraction.
Oh. Yeah.
I don't want to. Can we please just go to a different hospital? They won't get me in like that.
Hello?
How far?
That's another 30, 40 minute drive.
GPS UAB from here. Right now. GPS UAB. Can you just GPS? No, I'm not gonna stay. We've already been here for an hour. It's gonna take them another 30 minutes to get me back, if not longer. By then, UAB, women's, and infants. Let's go. That's how I feel. I don't want to do this. Because if something is wrong, then it's going to be a whole nother fight and argument, and I'm going to be in labor. Can we please go? Because I'm not going to go into labor and then them try to force me here and hold me here and give me more issues with her. I'm not doing it. I'm hurting. This is ridiculous. We can go to UAB. UAB will get me in right then and there. I should have never transferred out of UAB. I guess the only thing Grandview's got going for him is filet mignon when you push a baby out of your vagina. No. Austin, please. No. I don't want. You don't know that. What if something happens I am in labor? Then what? I'm stuck here. Having issues with her. And then what are you going to do? Sit out on the floor with her?
No, I'm not. Just how I don't have to.
But they're going to give us issues because we'll be up in labor and delivery.
I can't wait to see those. If that's the case. And if they would have asked for it down, that'd be even better.
No, it's not.
No, it's really not. But they don't realize.
No, I can sue Grandview and go to a different hospital. That is how I feel right now. I don't want to be here anymore. Like, I really don't want to be here anymore. Austin, please. No, I don't want to be here anymore. I have a right to my treatment. I have a right to the treatment I receive, and this is not what I want right now. I'm going to be sitting here waiting for another 20, 30 minutes anyway. At that point, we'll be at UAB. UAB will get me straight in.
6:45.
We've been here for an hour as it is, please.
Yes, I want to do that there. They're covered out.
I don't want to. I just want to go.
That's good. Just relax.
I don't want to be here. I don't leave. I don't want to be treated here anymore. Baby. I'm hurting so bad. All this whole day has been ridiculous. Please. I just want to go. They're not going to. How many times have we been to UAB? How many times has somebody different been on duty and they've never given me an issue?
My door was here?
Yeah, they ordered a
I was quick.
This is how they treat disabled pregnant women. It's wonderful.
I thought you were 37.
36. Tuesday, made 36.
Hey, hon, I'm gonna take you back and get some x-rays done, okay?
They're obviously not coming down right now. Austin, please, I don't want to be here. Do I have to get up and walk out by myself? I am pregnant. I should be on labor and delivery. I should not be in the fucking ER. That's what you don't seem to understand. they're treating me as an ER patient when I'm supposed to be on labor and delivery. MEU. Remember? UAB. UAB. Please, can we just go to UAB? They're gonna treat me so much better. After everything that's happened, you think they're gonna do a decent job here? Honestly. Honestly. That's not the point. No. They wanted to surround me with security guards and everything else that people bent over in my face. Like, what am I gonna do? I'm sitting in a wheelchair. You got security guards around me. What am I gonna do? Go off and attack? I wanna go. Now. Listen, I'm gonna have a panic attack, please. And this is it. We're leaving. I'm not doing this. We've been over here for over an hour. They won't bring me up to labor and delivery. I'm 36 weeks pregnant. And I can't do this anymore. We're going to a different hospital. Maya, it's a good girl. Thank God for UAB.
Please don't be.
go right to the desk. Turn. How do you run into that?
They're gonna give me a sticker, yeah.
Emmy is expecting me.
Okay.
Better get some care, okay?
Mhm.
We just left Grandview and they gave us so many problems. Yeah, we just got transferred from here at UAB over there to Grandview because we're a lot closer to Grandview.
Well,
but
UAB said it wasn't high risk anymore, and then turns out I still am, and it's just, I just want to come back to UAB. I don't even want it. I'm supposed to be induced in 12 days. I don't even want it.
relax, okay?
This really hurts. I just got off the phone with someone in LND, and she said to come on up. Thank you. Right. And then left. Well, she said they did. This is how you should be treated when you go into a hospital with a service animal. Huh.
Going up.
This is third floor, right?
Yes, third floor. May I sit? Good girl. You're a super good girl. All right, back. Come on. Oh, you okay?
Yeah, I'm fine.
Ow, ow, ah, ow, my hips. Ow, my hips.
Okay, slow down, speed up. Which one?
Let's go. Oh, yeah, there it is. Left. That's the button. You just do it. I'm done here.
I don't know what it would say to
Hi,
me.
can I help you?
Dominique Weems.
Okay, you can come on through.
Thank you.
Okay, lift your feet up. Push it. Okay.
Yeah, that's not gonna happen. Not with the way my hips hurt.
Help me out.
Ow. Good girl, come.
There you
Hi.
go.
What you guys here for today?
I was at the dog park and me, my 4-year-old, and my service dog, they were running around playing, and then somebody brought in an aggressive dog that immediately started trying to attack her. So I got my 4-year-old out of the way, and then I jumped up and ran, trying to get this other dog away from my service dog because he was literally trying to like rip her face apart. And I guess I hurt myself somehow. I ended up falling, and I am in so much pain right now. My pelvis, like the pelvic area, I cannot walk. He is literally picking me up to put me in the car and picking me up to get me out of the car. I can't. I'm in
They're supposed to be induced in 12
yeah,
days.
and I'm supposed to be induced in 12 days. Baby's low oxygen, small. He's 4 pounds 3 ounces right now from the ultrasound yesterday. I'm supposed to have 2 more ultrasounds next week. I'm going under fetal stress monitoring and just a lot.
Okay. All right. Wait right over here. We're going to get you back in the room in just a second.
Okay, thank you.
Thanks, ma'am.
No. Good girl. Sit. There you go. Lay down. I don't know, but I'm going to prove a point because here we are, labor and delivery at UAB. Literally, look at that. We are at UAB now after all of this. And think they're getting induced. Yeah. They're prepared for them. We're kind of last minute. We're not even actual patients here anymore, so.
Yeah, I know. So what they told you over the phone? They said it was all gonna be okay.
Yes.
Gosh.
I told her about the whole service animal thing over the phone, and she came back, you know, did what she had to do on her end, because I'm not a patient either, you know.
Right.
And so, I'm no longer a patient here, so. Maria's a good girl. Yep, a good girl. A good girl. Thank you. My anxiety is like so much less being here. I'm not in the emergency
room.
room.
Back there with the dog.
It's not even that. It's the fact that the emergency room, guess what? They don't really have everything to examine me. They just wanted to get me in and out. At least up here.
We went back there last time.
Multiple times.
So nice to us.
We've been here like 3 or 4 times with her.
And went back there.
Yes. Legally, once you hit a certain part in your pregnancy, legally they are supposed to send you to labor and delivery.
I noticed when, like we said, that we were recording their time, the way they were wording things changed. And that's when I stopped. And I
But
said,
it still didn't change the outcome. You know what else was on video? Me saying, so you're telling me I'm not allowed up there. You're denying me that access. Yes. I have that word for word on video.
Hi, you ready to come back?
I think you remember us.
Huh?
I think you might remember
I don't know if I was with you last time. Miss Debbie's here, and she said she remembered you from the last time you were here.
Oh my God, thank goodness. We just had UAB transfer me to Grandview because they said I was no longer high risk. They were wrong. I am still high risk, and I'm supposed to be induced in 12 days. We went to Grandview because I had an accident earlier. I literally like cannot walk right now. I'm in so much pain. And Grandview made us, we were over there for over an hour arguing with them for about, and then they kept saying they were coming to get me, they were going to come get me, and they were going to examine me in the ER. Never did, and refused to let me up to labor and delivery. And I'm over here like, my baby's having issues, and I didn't know where else to go.
You're perfect here.
I've seen you before. Grandview just gave me the worst because UAB transferred me to Grandview saying I was no longer high risk. Okay. I still am. Okay. Baby, I'm 36. Baby's 4 pounds, 3 ounces.
Yeah, baby's grown small.
He's small. They think it's oxygen. I'm supposed to be induced in 12 days.
Okay.
So we went to Grandview because of the fall or whatever I had earlier, and they completely denied access. They were not allowing me. They refused to allow me up to labor and delivery and everything else. And
let's take care of you here.
Yes.
Thank y'all.
Okay.
So much. I really didn't know where else to go.
So you've been here before, so you know the deal.
Yep.
You're here for pelvic pain.
I can barely walk. So what happened?
Okay. Tell us what's going on.
Okay. So I have a 4-year-old, and I have her. He wanted to go to the dog park and run around and play with her, and so I was like, okay, we'll do that. Okay. And usually we don't have any issues. About 20 minutes of being there, I'm sitting on a bench. He's running around playing with her. There's no other dogs there currently. Someone brings in an aggressive dog. As soon as the dog comes in, it starts trying to attack her. And I mean, like, going for her face. She's running as fast as she can, trying to get away from the other dog. I make sure my son's safe and out of the way. And I jump up and I start running and trying to get her and get this, get between them, because the owner was just standing there like laughing. Oh, she's playing. And I'm like, your dog's trying to bite my dog in the face. And I'm yelling at her, she's a service animal and you cannot be letting your dog bite her. Like, that's not okay. And he was actually on the phone with me when it happened. So after I finally get the dog separated, luckily she's okay. Thank God she's okay. And so I get them separated. I get my son, make sure my son's on the other side of me. I get them out. And I was already in a lot of pain. And I think the adrenaline started going down. And then the pain hit me so hard, I fell straight down. And he is literally picking me up and setting me down in the car. Like, I can barely, the pelvic, I don't know what I did.
So where's the pain at?
Exactly. It is like And thank you to UAB for getting me in immediately. Like, does it say UAB on this? I don't think it does. Where's your shirt? I already showed that. Maya, guess what? Up here in labor and delivery with me. No problems, no questions asked. They're treating me so much better. I'm still like anxiety ridden, but this is how a hospital should treat you. What Grandview just did was ridiculous. That was so uncalled for. So we are in the MEU at UAB. So this is on the labor and delivery floor. They have no issue with my service dog being here with me now or when I'm in labor. I'm actually finally hooked up to the monitors to keep an eye on the baby. And I cannot believe what we just went through at Grandview. Like, I just got transferred over there, and I cannot believe what I just went through with them. I've never, like, you have a pregnant woman in pain, possibly going into labor, and you want to argue about her service animal that is allowed under federal law, and then make her wait for over an hour. So this is how it should be. I'm high risk again, so I hate that UAB missed that to begin with, but we know now, and I'm at the point where I want to come back to UAB because they are always so nice. I've already had the doctor come in. She's talked to me. She's checked me. Maya is in the corner with my husband. No problem. Like, she legally should be allowed to be. So I'm just going to try to relax. And they are picking up a few contractions. So we're just going to keep an eye and make sure nothing like that gets worse. And keep an eye on the baby's heart, and then try to figure out why I am in so much pain after the incident that we went through. So